This is One on One. Welcome to One on One. I'm Steve Adubato. For the first time, I want to introduce you to Jim Martin, who's the Chief Executive Officer of Health Republic Insurance of New Jersey. Good to see you.
Good to see you too, Steve. Thanks for having me.
It's our pleasure. Put in perspective, Health Republic Insurance of New Jersey. What are you and why do you matter?
We're an insurance company, Steve. The first cooperative insurance company in the state of New Jersey.
What does that mean, cooperative?
Consumer-owned, consumer-oriented and operated plan. Our members will be our governing body. They will make decisions about how the plan proceeds get utilized.
How do they do that?
They will have an opportunity to vote as to the use of proceeds. As a not-for-profit, we have no shareholders. So the members will be the ones who determine, should we return, should we reduce premiums next year if we have that opportunity? Should we expand the program? Should we offer things not traditionally covered? We have, as a co-op, a mandate to innovate. The federal funding that we received suggested that we should be creative in the marketplace, because there's a sense that the marketplace has not been very open, has not been very appreciative of new opportunities.
Let's put that in perspective.
Okay.
When you said the federal government created you, put it in perspective. Was it $107 million?
Yes.
From the feds? They created you, right, to do what?
They released requests for proposals.
Got it.
To develop an alternative insurance company in each state. We're one of 23 that were established.
Right.
As such, we were granted loans. They are not grants. They need to be repaid.
Is this in connection with the ACA?
It is. We're a direct byproduct of the Affordable Care Act.
Got it.
And as a result, we received a portion of that money to startup, because any new business needs startup money. And to start up according to certain criteria. One of those criteria is that it needs to be a cooperative, as I mentioned, and that we need to be not-for-profit. We need to make sure that the members constitute a substantial portion, the majority of our board of directors, so that they will, in fact, make decisions as to how proceeds are spent.
And the other thing I know, because we've had offline conversations, is that you cannot spend your money on
marketing.
But you can do education, outreach, public awareness, which is how we met each other. Exactly. Because dollars are going toward public education and outreach that we're involved in right now.
Exactly.
But why not marketing and, hey, buy our products? Why not that?
The terms of the loans, and they're federal loans, was that the dollars couldn't be spent on promoting sales. So we can't bring someone to purchase our product in our promotional
The federal
materials.
government doesn't want you doing that.
No.
But why is it so important about public? It's so interesting because there's so much confusion. Because people are so, hey, I can't make sense of all this information out there. My sense is that the federal government believes that public education awareness is priority number one.
I couldn't agree more. And their hope was, and the expectation was, and in many states, significant federal dollars were allocated for just that.
New Jersey a little behind on this, Jim? Sorry for interrupting. New Jersey a little behind?
We're considerably behind. The state was given approximately $9 million to inform and educate and help the citizens of New Jersey learn more about it.
Could have had more?
That money wasn't spent. And it would be, then there was opportunity perhaps for even more. The states that you're hearing about as rallying to the marketplace received mega millions of dollars, and it's been effective.
Well, hold on. In California, what are they spending on public awareness?
They received in government grants better than $900 million.
For public awareness and education.
Exactly.
About trying to make sense of this massive, groundbreaking changes, or these multiple changes with respect to healthcare, health insurance, et cetera, and New Jersey has
spent $1 million and has $7.5 million unspent.
And in New York State?
Oh, I'm going to estimate about $250 million. You've seen, in New Jersey, we see a lot more of their ads on the television, et cetera.
What impact have we seen so far as we do this program, in 2014, relatively early? This program will be seen after as well. Have we seen a difference in terms of enrollment with respect to that?
Significant. What we've experienced is that there's a certain inertia that's hard to overcome. It's a bewildering environment, as you mentioned, for many people. What is this new marketplace? What's the exchange all about? How do I enroll in insurance?
Sure.
And we've also found that it's a very complicated process. Those of us who work for large companies always just put a check in the box that year for what you were choosing. But we have experienced that individuals who are enrolling for the first time or trying to make a change are finding it very complicated.
But you are
so they need
optimistic.
assistance.
Sorry for interrupting, Jim.
Sure.
But you are optimistic about the long-term impact or the potential impact of the Affordable Care Act, aren't you?
Absolutely.
Because?
It's needed. We all know that healthcare reform has been needed for a long time. We can't afford where we are with the gross national product.
Status quo, not an option.
It's not an option. So reforming the insurance programs and plans, offering more affordable options, offering alternatives, is one way to help that process of informing and reforming the healthcare delivery system in the states of in the United States.
So Jim, when people listening to us right now, or people hear the multiple debates that continue to go on across the country, you say, this is confusing to me. You say what?
I say, be prepared to spend an hour really thinking about what you need, what your healthcare needs are, what your family's needs are, what your concerns are. Do some homework, and then go to a web page or get some information specifically to say, how do I enroll now? You've given some thought to it, so it's less bewildering. And with that, if you were to go to our web page at Health
If they went
Republic,
to your, say if they went to your website,
Yes.
right? Can we put it up? Right, it's up there right now. They go to your site. What do they learn?
they'd be able to understand the many different plans that are offered, the amount of out-of-pocket or deductible. They'd learn if they clicked on the page where our QualCare partner is their physician, is the hospital they prefer in the network that we're offering. They will then, if they see something that they're very interested in and want to know if they qualify for a subsidy because of their income level, be able to click on a portal that will take them to healthcare.gov, which is now functioning quite well.
That is the national
That's the national
website.
one. And that will help them determine, based on income level, are they eligible for a subsidy to pay for that which they saw attractive.
But you say the key to this whole thing is investing that hour because it could pay off big time in terms of learning what you need to learn.
Absolutely. Understanding what you're looking for when you go in. Any major shopping consideration, you usually give a lot of thought to.
People spend a lot
Health
more than an hour.
insurance
Yeah,
is,
people spend a lot more than an hour
yeah.
than buying a car. Jim Martin is the Chief Executive Officer of Health Republic Insurance of New Jersey. Jim, thank you very much. We appreciate you being with us.
Thank you, Steve. I appreciate the opportunity to be here.
Good stuff. One-on-one. We'll continue right after this. Thank you, Jim.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the Healthcare Foundation of New Jersey, transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.